changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show for February 18th, 2020. Wow, we're ripping through halfway through February already. That's amazing. We're going to be talking a lot about family medicine this evening with Dr. Nasreen Ghazi. She's from FAU Medicine, part of the FAU primary care team. You may remember back a little earlier in the show catalog, we had Dr. Leonard Berkowitz on, so we're so happy to have Dr. Nasreen Ghazi as well. So without further ado, I'm going to welcome Dr. Ghazi to the program. How are you doing this evening?
I'm great. Hi.
And thank you. And I always say thank you for joining us on this adventure of health, because we always learn so much from the practitioners, who sit in that same seat and tell us a little bit about their areas of interest and what they do. So let's get right into it. So talk to us a little bit about family medicine, because I know it encompasses a lot, right? I mean, it's just about, everything, that makes a family, the engine that makes a family chug along. So tell us a little bit about that.
Well, first of all, thank you for having me here. So as a family physician, I think that most people kind of would be familiar with us in terms of like literally taking care of the entire family. So we like to say sometimes womb to tomb. So for example, when I was in Philadelphia, I actually did prenatal care. I delivered babies. I was the pediatrician for those babies. I was mom's doctor. I was dad's doctor, grandma's doctor. So I helped people throughout every stage of their life. So like when we're talking about family, we like actually mean families. And it's my like favorite. Like I'm so happy in terms of like what I do. It's really a privilege to be able to be a family doctor.
And we're so lucky to have you here in South Florida. I know you've started with FAU Medicine. That's a great group that just around the corner here at the Gallon Medical Building, 880 Northwest 13th Street in Boca Raton. We'll give out the info a few times tonight. It's faumedicine.org. And tell us a little bit about how you can also, so you said womb to tomb, but you're also, in this area, we have a large baby boomer population, a large, senior population, elderly population. How can the type of care you offer help that population?
Well, truthfully here at FAU, I'm not able to do all of the spectrums of ages like I was in Philadelphia. So in terms of like what I'm able to do for the baby boomer population, I think a lot. Because I feel like as a family doctor, I'm familiar with, kind of like the different stages of life and kind of what to prepare for. And also I see myself as kind of a preventative physician. So my goal for my patients is not only to help manage their chronic problems, but also to help reach whatever goal they have for the future. So for example, for like a baby boomer, maybe they have a goal of, they like golf or they like to play volleyball or whatever it is. And so my goal is to try to help them to continue to stay active. We check your cholesterol, we check your risk for diabetes. We look at your healthy eating and stuff like that. So you can continue to do the things that you like doing for as long as you can. So I actually feel like it's a family physician. And, I don't want to I love all of my friends and all the different specialties. I'm just especially passionate about mine like everyone else is. So I don't want to exclude all of my other colleagues, but I really feel like we do a great job.
And preventive medicine, that's been a huge movement towards that in this country in the last few years. And it used to be kind of, you went to the doctor when, something was wrong and you had an ailment or you needed to be seen on the spot. But nowadays, which the population still sees you for that, but nowadays people are going, for checkups every X amount of months. And you're able to, like you said, work with goals and check, the numbers, see how everyone's doing, cholesterol, etc. So that's got to be so important, moving forward for healthcare in this country.
Right. No, I'm so glad that there is that kind of focus, especially right now, because, rather than having a patient, for example, rather than having someone get diabetes and then have a stroke or have a heart attack. Like if I can help someone to eat healthier, avoid or at least help them keep their sugars in a good place. I'm just using diabetes as an example, and then help them to prevent or do what we can. I mean, we don't have, I only have so many things that I can do, but the things that we have are actually pretty effective. And we use evidence-based medicine for all of it. So, we look at the studies and we give advice in terms of that. So we do our best. But I think that it's much better to try to prevent a chronic illness or like an event like that rather than wait for it to happen. So I'm really excited to be able to help people kind of reach those goals.
Yeah, definitely. And like I said, again, we're excited to have you here in South Florida. So you've been at FAU Medicine a little while. What are some of the more common ailments that walk in? And the second half of that, kind of explain it. So, a lot of people here at FAU, they know it's an academic institution. They know about the medical program, but they also have a primary care that's available, not only, to the employees of FAU, et cetera, but also the community right here. And I'm going to give out that information again. So, if you could talk a little bit about that as well.
Well, at our practice, I think the main reason that I decided to come to this particular practice was because I was really excited about being able to be a physician for this community. I think that the university kind of saw a need that was there for like more primary care physicians, and so they created this practice. So it's cool to be able to serve the FAU college and university community, but it's also cool to just be here for the community of Boca. And I'm really, really excited about that. In terms of like the patients we see, in our primary care practice, we get a couple students here and there, a good amount of faculty and staff, and, people from the community, as I said, and people come in just like all ranges. I have patients who are, like I said, students in their teens. I have patients who are in their 20s, 30s, young families, like a lot of moms and dads and couples. And then I also have I have patients like in their late 90s. So it's really cool. And I think that's why that's another reason I love my job, because I'm never bored. Like there's always like something to talk about with somebody that's interesting. And also just like to be able to switch between the different ages and see what's going on. In terms of like the most common ailment, I mean, it depends, because that's why I love my job. So like my husband's a specialist, and so I feel like I make fun of him a lot because he only has like one thing that he deals with. But I'm like, I could never be bored because I always have like 10 different ailments that I will deal with in a day. And so I couldn't even tell you. I'd say the number one complaint maybe that people come in with is like, I'm here to establish a primary care doctor.
Oh yeah. And you're really easy to connect with. So that's going to be, huge for FAU Medicine and for your career moving forward as well, because you're being able to connect with not only like, I guess, the millennials, but also, the older population we have. One thing about South Florida is the population is so diverse, and it's, you got a lot of people retiring here, like I said before, a lot of baby boomers, but then you have a lot of people coming here for all different reasons, right. To the state of Florida. I think we're like number one in the nation for people relocating. I think I read an article about that recently, so that's huge as well. So you came here. Let's talk a little bit about how you got here. You came here from, you mentioned before, Pennsylvania. Is that where you did your education and training, or did you also have some professional experience there as well?
Well, I went to medical school at George Washington University in D.C., and then I matched to family medicine residency at University of Pennsylvania, Department of Family Medicine Community Health. It's a mouthful. And I graduated I graduated medical school in 2009, and then I graduated from residency in 2012. And in residency, I just found myself really drawn to women's health, to obstetrics, like I said, maternal child health care. And so I ended up staying on as faculty. So I was so lucky to be able to stay there until like February 2018. And so I taught from I was there, I was teaching residents, teaching medical students, but also just seeing my own patients, being on the labor floor, delivering babies, being the pediatrician, as I said, in my own clinic. So I think the coolest part about being able to be there was delivering a baby and then seeing baby in the clinic with mom, 4 days later, and then being able to also assess mom's concerns, like the breastfeeding and maybe discomfort after the delivery, and then worry about how's the baby doing and be able to deal with all of that in one visit. Then being able to give that excitement that I have for maternal child health to the residents and to the medical students. So it was great.
Yeah, it sounded like you had the perfect training for family medicine. And then, of course, you're giving back by teaching the medical students. Mm-hmm. And then, and now you're here in South Florida. So I want to give out the info again before we take a quick break. It's Dr. Nasreen Ghazi, family medicine, FAU Medicine Primary Care Team. It's faumedicine.org, 561-5665-FAU. It's in the Gallon Medical Building, 880 Northwest 13th Street, right here in Boca Raton. I actually had a chance last year to go to this FAU Medicine, and it is a brand new, modern practice. Mm-hmm. I actually went to FAU, so I was really interested to see, what was going on over there. But I was actually blown away. The building is a very modern building. Very, like I said, everything's new in the practice. It's definitely a great resource for the community, and I think a lot of people should check it out. So I want to ask you a little bit more about your areas of interest, but we got to take a quick commercial break, and we'll do that on the other side on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond. Welcome back to the You and Your Doctor show. We're here with Dr. Nasreen Ghazi, family medicine, FAU Medicine Primary Care Team. So there's a team over there at FAU Medicine, the primary care. We had, like I said, Dr. Berkowitz on before. We've learned a little bit about you this evening. Tell us a little bit more about the team and the
physicians are also family physicians. Dr. Mandy Sakel is one of them, and she's a geriatrician. So she actually is a family physician who's done extra training in order to be specialize in geriatrics. And then we have, Dr. Berkowitz, as you know, and we're all, and then Dr. Thank you. Yes, I forgot. Dr. Borgia is also going to be starting, and we're really excited to have him because he's going to be helping us with integrative medicine, and I think that's going to be great for the community. And also, the one thing that I did want to stress is that it's cool to be able to be the academic practice kind of for Boca, and that we're always accepting new patients, especially because we're new and we're growing. So we're excited.
I think that's a great tie-in to the academic institution as well, and every time I hear something about FAU medicine or FAU's medical school, I'm so proud because, like I said, I went there. I graduated in 2007, and it's just great to hear that program and what you're doing here at FAU Medicine Primary Care is just it's just really amazing to see the growth and just last year, like I said, having Dr. Berkowitz on the show, and then now there's 3 other practitioners in the office. You have you're specializing in your primary care, but also in different medical specialties, geriatrics, family medicine, but you help with women's health as well, or you're really focused in women's health as well. Let's talk a little bit about that, because that really is one of your expertises. You mentioned family medicine, obstetrics, and can you also talk a little bit about how you're able to, I guess we'll start with help women with contraception?
Well, because of, I always tell the medical students and the residents that I help teach that it's important, if you're going to be a primary care physician, you're gonna have women as your patients, and the reproductive your reproductive age is for a while, and you can't forget kind of the needs that a woman needs at that time. And so I feel like it is my responsibility to be able to help a woman with whatever her choices are going to be. So, we're able to help with the different contraceptive choices that are out there. I'm able to help with IUDs, the Nexplanon implants, or, just a regular pill, NuvaRing. There's a lot of different choices out there. My main goal is to help a woman choose what she wants to do. And then I just lay out the choices. I like to also be not only do I like to teach the medical students, but I also feel like it's important for me to teach my patient. So every time that I always joke around at work that this is my favorite conversation to have, because it's so much fun. I get out a piece of paper and then I sit there and I draw out the uterus and the different things and the ovulation and the cycle and it happens. And then what each different birth control, each different contraceptive choice, how it relates to the cycle and how it works, so that my patient understands these are your choices and these are the pros and the cons for each, and they understand. I'm not exactly giving them the pathophysiology of it, but just so that they understand these are why these are your choices.
I always think it's easier to understand when you not only hear it, but then you're able to see it while it's being explained to you. I mean, that's a neat point, because you don't always see that. It seems like you take a lot of time with each patient and really explain it, and I think that's of utmost importance when people are visiting the doctor. If they have time to really get comfortable and you're there to help them make the decision, but also leave the decision to themselves, I think that is outstanding.
We're actually really lucky because we have the time. Since we're a growing practice, there's a lot of leeway in terms of how much time I have for each patient, and it's really nice.
That is great. And then also you can help with hormonal replacement counseling. Tell us a little bit about that as well.
I'd say it's similar in terms of for the birth control. When a woman kind of reaches menopause, depending upon her symptoms and how bothered she is by them, you can certainly start hormonal replacement therapy. And I just go through with the patient, it's the same kind of thing, explain why this happens, how it will help you, the pros and the cons. And it's like I said, a fun conversation to have, and it's fun as well when you get to help someone and they feel so much better. They whatever goal they have in terms of maybe I want to have less hot flashes, or maybe I want to feel less uncomfortable or something like that. Those are things that we can help work on, and we just work on a way to do that within what the patient is comfortable with.
Yeah, and I like how you keep on going to goals. I think that's great that people, never thought really of having any goals, but, nowadays that seems like a great, thing to have with the way preventative medicine, helps people out. But that is great that you're able to, have people build goals to, where they want to be. That is really neat.
It's really cool because I really feel like as a family physician that I get to know my patient, and I want to know, I want to know who they are so I can help them get where they want to be as much as I can do. I mean, I can't do everything, but I can at least help them with things to be able to, like I said, do what they want to do.
We're here with Dr. Nasreen Ghazi. She's family medicine physician, FAU Medicine Primary Care Team, faumedicine.org. Or I'm told there's also an faumedicine.com, whichever way it's easier to type in. The number's 561-566-5FAU. They're located in the Gallon Medical Building, 880 Northwest 13th Street, right here in Boca Raton. So that is a great community practice. Let's stay on the women's health topic a little bit more. When does a woman need a pelvic exam, and is this part of your preventative medicine focus?
That's actually a very interesting question because, excuse me, the thing about a pelvic exam is that it's part of when a woman has a complaint. So if she's having discomfort or something like that, then it's important to do a pelvic exam. I always stress to the medical students that especially if a woman comes in with abdominal pain, lower abdominal pain, you have to think about the pelvis as the possible cause for that abdominal pain. So you can't ignore that part of the body at all. You need to do an exam. But in terms of preventative care, there's actually not a whole lot of data in the evidence that it's helpful to do one if someone doesn't have a complaint. So there are, I think, some patients who are a little more old school and they're used to having a pelvic exam. And so I'll do one if it makes them feel better. But if a woman is not having a complaint, I don't usually do one. But in terms of the preventative care related around a pelvic exam, for example, if it's time for a pap smear or it's time for your yearly STD testing or something like that, of course, I'm going to do a pelvic exam because it's related to that. But if it's not that time, I don't think there's a whole lot of evidence to do it. So it kind of depends on the situation, basically. I hope that makes sense?
Yeah, definitely. Mm-hmm. I wanted to ask you, can labs be done in the office there at the FAU Medicine Primary Care?
Mm-hmm. We have some great MAs who are also phlebotomists, and they they're able to take lab work. So I actually think it's really nice for our patients because basically what will happen is, I'll have to visit with them. I'll chat with them. We'll determine what they need. And then when there's lab work that needs to be done, we just have them sit in the lab and then they get it done. And then also let's say they're busy. So they're in a hurry. They came during lunch. Then we actually can just schedule a lab visit where they don't even have to see me. They just let the front desk know I'm coming at this time, and they come and they get the lab work done. So it's super quick. And then the cool part is that I can actually send the results back to the patients via the portal, which is kind of this app. So if it's completely normal, no one wants to it's easy. You can look at the results yourself, and I don't have to call every single person to be it was normal.
Yeah, that is
I can
great.
just write an email and be it was normal. Please take a look and let me know if you have questions. And then if someone has questions, we talk back and forth between email or I'll just call if that's easier.
Yeah, nowadays with the portals, people have their phones on them. They can go right there. They know, about the time, when the results will be in, and then that makes it so much quicker. Wow, it's hard to believe we've already ripped through 30 minutes, but gotta ask you my last question. Listeners always know about this. What are your hobbies and passions in life outside of medicine?
Oh, I have a ton of hobbies. I have 3 kids, so I don't know if that's a hobby, but they're under 7. And then I also love to knit. I like to sew, and I like to read. So
nice.
Yeah, I'm a little bit of a nerd.
Oh, that's great. Well, thank you for letting us get to know you and about your areas of interest in family medicine. It's Dr. Nasreen Ghazi, FAU Medicine, faumedicine.org, 561-566-5FAU. If you're looking for a primary care doctor, here's one right here. It's great to connect with. We'll see you next time on the You and Your Doctor Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.